right, here we go. I'm just going to make sure everything's looking good and we'll get going. All right, looks like we're good. Okay, that's good. Let me just share this on Twitter and then we will begin with the usual festivities. So, all right, here we go. Here we go. Our channel. Here we go. Here we go. Let me just share this on Twitter and then we will begin with the usual festivity. Okay. Here we go. Here it comes. Alrighty. Well, happy Saturday, everybody. I know a great many of you who will watch this at some point or come chat are familiar with who I am and what I am, but hello, I am Patrick Lockwood. In many cases, I'm considered Dr. Patrick Lockwood, licensed clinical psychologist, but for the purposes of this 13th episode of UnShrink Me, the UnShrink Me podcast, this is just Patrick. And the reason that I say this every time is simply because I want people to be 100% clear that this is not mental health advice. I am not acting in any professional capacity in this podcast because this podcast is entertainment only. These are my personal opinions. Now, because I am the person who happens to work in this profession of clinical psychology as a professor, as a treatment provider, as a therapist, as a consultant, I will obviously be talking about my experience and what I believe I know and what I believe I don't know. But I am not acting as anybody's therapist, so please, please, please don't sue me. That's not why I'm here. Anyways, moving right along. This 13th episode, there's so many things on the docket, many things I did not get to last week because so much was going on. What I would like to start today's little broadcast with is a reminder that life is really short. Make sure you're doing what you love, eating good food, having good sex, having good friends, having fun, laughing, because life is short. Take good care of yourself. The shit that people think matters usually doesn't. So, on to the Twitter/X bookmarks. So many cool things to talk about today. What I was going to talk about last week specifically, before I get started, unfortunately not sponsored, NOT, not sponsored by Celsius, but I do love it. It just tastes good. And caffeine. Last week, I was going to talk about this critical psychiatry conference. So I'm going to retweet this while I'm talking here. Talking about this on my podcast right now. All right. So I just retweeted this. If you're following along or if you want to go see what I did, this is Dr. Evgeny Legerin. I don't know. I'm so sorry. I just butchered your name. At Dr. At the handle is at DrEvgEnYLEGEDIN. Excuse me. I'm so sorry, Doc. But he's saying, I'm at the Critical Psychiatry Network Symposium at UCL, London. He is talking about this person who is speaking, her, a psychiatric survivor, Dr. Kathy Wield, W-I-E-L-D, on tapering off her psychotropics and starting psychotherapy. Recently, she published a book, in quotes, Unshackled Mind, on her journey to freedom and the remarkable healing that followed. So, there is, if you are not aware, a great battle in the online world at minimum and in the academic world about psychiatric medications. And I think a lot of it's stupid, but I also realize that many people have lived experiences, which seems to be the trump card for the last 10 years, that appear to be so pervasive and powerful that they feel moved to do things like write books and so on and so forth. And so I don't know Dr. Wield at all. I've never met her or even read her book, so I have no clue what it's about other than her getting off of meds and her experience. And the book is again called Unshackled Mind. So there's a couple of things that I take issue with here in these kinds of posts. So I am extremely critical of my friends in psychiatry because in clinical psychology we tend to work hand in hand and have somewhat similar training, but obviously as non-physicians, clinical psychologists do not have the right to prescribe, the legal ability, the training, or the knowledge to prescribe. Now, we do have psychopharmacological training. I do teach psychopharmacology classes for my university, so I'm fairly well versed in the various types of psychiatric medications and procedures. That being said, it's not my scope to actually talk about what meds are good or bad or why. Here's the deal. When a person, be it a clinical psychologist or a psychiatrist or any other professional who works in the mental health world, talks about somebody as a psychiatric survivor, I start to become a little bit confused at minimum and then eventually frustrated, because for me at least usually confusion leads to frustration. So it seems kind of drastic and dramatic to describe yourself as a psychiatric survivor. Now, that is not to say that some people are not forced on medications. I know of instances where people were dosed by their families on medications. So, like, I know that all sorts of abuse can legitimately happen. And I am 0% on board with the appropriate retribution and, compensation for people who are genuinely harmed by any medical provider or psychiatric or psychological survivor. I'm just 100% on board with what people genuinely call justice. If you are hurt and you have a real claim. What I have a question about, and again, I would have to read the book to have an informed opinion, so I'm not trying to pretend like I have an informed opinion, is the phrase psychiatric survivor. Now, maybe her story is so horrific that she was put on so many medications and nobody monitored her blood or her hormone levels or her vitamin levels, and nobody checked in with her for years on end and just willy-nilly put her on medications. That could be possible. I don't know. Those are really abusive, terrible things I just described, like not regularly checking in with patients or not monitoring important vital signs and blood levels and all these kinds of things. Those are abusive and negligent practices, literally. That being said, I would be shocked if that was true, because it doesn't happen all that often that people are willfully or obviously negligent. There's all sorts of less willful or more subtle negligence that psychiatric and psychological providers engage in, right? So they don't do their documentation very clearly, or they struggle to get follow-ups done in a timely manner, but they still do them like a week late or whatever it is. So those kinds of things happen all the time. Another type of negligence that happens all the time in the healthcare world, generally, in facilities and programs and practices, is just not giving people enough time. 15-minute appointments are negligence, no doubt. But a lot of these models are 15-minute models, and that's bad. So it's really the case that, I have no clue what the truth is for Dr. Wield, and I don't think it's the most accurate way of describing it as a psychiatric survivor. She might be a psychiatric survivor. She might have been horribly abused by the medical profession and or the clinical psychology profession. And if that's true, that sucks, and I feel bad. I just doubt it. what I believe probably happened, which happens unfortunately a lot, is there's various types of garden variety neglect and negligence, which I just described, a couple of instances. So there's that. Also, the anti-psychiatry movement is usually full of people who have their own subjective experience of bad things. That's all valid, but it's not the same thing as like surviving a crisis or a trauma. Sometimes people are. I just doubt it. But I could be wrong. I don't know. All right, we're going to move on. We're not going to belabor that particular point. All right, next post is from April 5th. One of my newer Twitter mutuals is a guy named Jonathan Cogburn, I guess, LMFT. His handle is at Systemic Texism, TEXISM, which I think is a play on systemic racism, if I'm not mistaken. So he's responding to actually one of my posts, which I will read, and then I'll read his post, which I think is definitely worth discussing and elaborating on because this message can't be sent loudly enough, clearly enough, or consistently enough. So I posted something a long time ago, and I've just pinned it to my profile because I think it's important here on Twitter. And it goes as follows. Here's what I said. You are not psychologically fragile. You have been lied to by society, by your pain, and by the people who failed to help you understand your strength. You are capable of more. Okay? So you are not fragile. You've been lied to by a host of people, professional and not. And you've been lied to by your pain and by the people who failed to help you, your family, your friends, your parents, so on and so forth, and the professional world. So he said, his post, which I think was April 5th, said, Systemic Texism said, 75% of people who endure traumatic disturbance, just going to post this real quick. He said 75% of people who endure traumatic disturbance make a full recovery without external support, like therapy. 52% of people who endure traumatic disturbance report experiencing post-traumatic growth directly attributed to their recovery process. 90% of people completely reconcile grief. Now, I think he's saying these things in support of my original post, that you're not fragile, which is true. I've worked with lots of very mentally ill people for 15 years as a recovery technician and as a low level 1 psych nurse in Missouri once upon a time, and as a pre-doc intern, as a postdoc, as a licensed professional. I've supervised lots of people. I have consulted. I've done all these things. And in my experience, not once have I talked to somebody who is mentally ill that I would consider them fragile. The connotation of being fragile is that you are inherently not capable. There is something inherent to you that you are either sensitive in a way that is endemic to your whole personhood and not just about a specific illness or vulnerability, and or you're just broken. And both of those messages, I believe, are highly pathological. And I think the people who distribute those messages, especially various types of socio-political and academic activists, they're interested in people being fragile because that's the only way they can understand them. Now, I don't know if those stats that Systemic Texism quoted are completely perfectly accurate, so please don't quote me or him. I'm sure they're generally correct. Matches my clinical experiences, matches my reading of the trauma literature and the PTSD literature. It is almost always like, broader society takes a mental health specific diagnosis or concept, overgeneralizes it, and struggles to understand the nuances of it. So what I'm very interested in, especially as a professor, I'm interested in all the nuances of things like trauma, because trauma is not uncommon. Trauma is actually very common, right? I'm part of the millennial generation. And over the course of my early development, I experienced a number of societal traumatic events like 9/11 and the 2008 crash and all this crap that most people don't go through in my development. And so what I would say is trauma is not weird or uncommon. It's not good. I'm not recommending it. I don't think people should go through it just so they can have a growth mindset or whatever. But it's not rare. So what I would argue with both my original tweet, which is "You are not fragile," you've just been lied to by your pain and by people and by society and the people who failed to show you how you're capable, is this. If it's factually the case that most people who experience something traumatic are okay and become okay, then what's different about the people who aren't okay and don't become okay? Now, it's true, some people are undertreated. Some people go undiagnosed. Some people are missed, right? It's very, very clearly the case that a great many people who go through trauma and other issues, who develop a real mental illness, will go undiagnosed because they don't have access to health care. They don't have access to providers. They don't have family who can see it. They feel ashamed. There are cultural norms that force them to be quiet or downplay what they're going through. All those things are real. I teach about these things. There's data to support that. And they're still alive. They may not be living the most functional life or the most healthy life, but they're alive. And they're not going to kill themselves because most people don't. Even mentally ill people, the vast majority of mentally ill people are not at risk for ending their life by suicide. So, trauma is not this catastrophic experience for a lot of people. It doesn't destroy their lives. But trauma undermanaged, mismanaged, or if that stat's correct that systemic Texism said most people don't need support to recover from their trauma or grief, then like professional support, then why do we talk about it all the time? Why is it such a hot button topic? And I think that's because society is looking for people to be broken and fragile. I think there are political narratives, social media narratives, economic narratives. I think there are people in power who want to see the mentally ill a certain kind of way. I think there are people in power who want to pathologize people so we can put them in a box and have power over them. One of my strong selling points, one of the reasons why I love the profession, is because I get to work with people who are very clear about the damage that it does when you pathologize people too much. You can over-pathologize people. And so I have lots of colleagues I trust and respect here where I live and across the country and a few across the world who do not over-pathologize people, do not over-diagnose people, right? Just to speak for a couple seconds on this, if you think you're fragile or if you think you're broken, then people have failed you. People have failed you. Maybe you're struggling to get the support you need from people, which is a you thing, but you internalize some stupid shit as a kid, as a young adult, that you are broken or you are less than, and you are not. You are not broken and you are not less than. Not to get all Albert Ellis about it, who is very prone to talking down to people or being very rough, but you are not broken and you are not stupid and you are not incapable. If you've experienced trauma or if you have a mental illness, that does not mean you are any of those things. It just means you're ill, or it just means you're currently vulnerable. That is different than being broken. Because people are complicated. People are living dynamic systems. And when you treat people like they're ill, guess what that does? It encourages them to act that way. And I think that's really stupid. And I think that's harmful. So, and there's a quick tangent I'd like to make. Our friend RFK Jr., in the MAHA movement, the Director of Health and Human Services, I think, said, he put out a tweet that was really popular a couple of days ago. He was going to figure out, he's tasked a committee to figure out what causes autism or what caused the increase in autism. And everybody started losing their minds on Twitter about it because we already know. So, here's something that I can maybe get a little feisty about, if that's okay with you all. So, he put out this post, and I'm going to tweet about it right now just to post real quick. Sorry for the delay. So, he says, by September, we'll know what caused the autism epidemic and we'll be able to eliminate those exposures. And so here's the deal. I think many people in politics, in medicine, in research, in academia are at war right now because they hate RFK. Whatever, fine. Which is stupid. But the vaccines cause autism thing, or what's the other phenomenon? It's all the harmful microplastics and all the harmful chemicals on food products and the seed oils. So let's just do this exercise real quick. Because RFK is basically saying, I've tasked a committee to figure out what's caused this drastic increase in autism in the last 20 years or so. One of my favorite posts was by my friend Ed Perrin on Twitter, and he posted an infographic that, the more the diagnostic criteria change in the DSM, the greater the prevalence of diagnoses. And it goes up linearly in a correlation, a positive correlation. So I agree with Ed. I think the diagnosis changing for the last 35 years is a big deal. That being said, I don't think it's that simple. So let's give the conspiracy-minded and the alternative health-minded people their due, right? Because I think as an academic, as a professor, this is a way of thinking that is important, right? You could call it multivariate thinking. You could call it avoiding the univariate fallacy. There's various ways to go about this. But I want to be clear up front to all the people who might like what I'm saying right now, or who might take a clip of this and share this with people or whatever. I am trying to be reasonable, and I am not trying to promote a particular perspective, because I don't actually have a genuine opinion about the rapid increase in spectrum disorders, other than, of course, if you change the criteria and make it more wide and easy to diagnose people, more people will be diagnosed. That's like saying the sky is blue. So, of course, I believe that's part of the process, but I have no clue what the whole process is. So, let's create a multivariate regression equation. Let's create a predictive equation that looks at all the potential variables that people, especially conspiracy theorists, talk about, right? So let's talk about all the obvious stuff first, and then we'll move to the less obvious stuff. So what could be causing an increase in the prevalence of autism spectrum disorders? Certainly, the obvious things are like overdiagnosis, because the diagnosis is too broad for the last 30 years. It could be greater numbers of people who have the few genes we're aware of. There's a few, breeding and reproducing. So more people with those particular genes, more people at risk. Those are two of the more obvious particular causes that we know something about, that are like saying the sky is blue. Fair enough. Because we're not locking, for instance, various types of autistic people away in insane asylums for the last 50 years and torturing them to death and keeping them from breeding, for instance. So, like, there's just so many obvious things that we could talk about. And those are the kind of the lower hanging fruit. Now let's start talking about the more conspiracy flavored things. So let's talk about pesticides. And I would be very interested to know if there's any large scale studies that I'm not aware of currently that look at like what classic epidemiologists do. They just take a large cross-sectional analysis study. They take a large cross-section of a population and they, run the regression equation. They see correlations between this, that, and the other. And so I'd love to know if there's like a 1 million person cross-sample, what is the correlation between eating foods covered in pesticides, like DDT or whatever, and what is the prevalence of autism? I would imagine it's probably tiny. I'm sure the correlation would be tiny, 0.1 something maybe. I don't know. But that's just 0.1. That explains like 0.5% of the variance or something. Who knows? So we have to move on to another variable, like vaccines. So our buddy Andrew Wakefield, if you haven't heard of him, literally lost his license because he admitted to engaging in fraud. He didn't lose his license because people didn't like his scientifically well-supported, well-validated results. He lost his license because he admitted to actually engaging in fraudulent data, creating fraudulent data. So, probably those original tiny sample studies, observational studies by the way, can't really take them very seriously. But what's the basic mechanism people are talking about? And I know that people like Brett Weinstein and Heather Heying have talked about this, so I'm not going to be redundant. Feel free to go watch their Dark Horse podcasts about it. Here's the deal. I'm not a biologist, not a vaccinologist, not a physician, so I could be very wrong about the things I'm about to say. Just trying to explain what I think I understand and how common sense it seems, right? Because I think this is what's happening, is things that seem very face valid and common sense are catching people's attention, right? So the idea is there's all these other chemicals in vaccines other than the dead or neutralized virus, toxic metals, adjuvants, things that are trying to like trigger your immune system that are bad for you. So when you give kids a bunch of vaccines before the age of 1 or 2 or whatever it is, are they being overly exposed to these toxic metals? And is that bad for their brain development? Again, that seems wildly face valid, right? Super easy to comprehend and understand, which is why people are running with it, I think. So you've got the pesticides on our foods. You've got the seed oils, which cause inflammation, supposedly. You got the vaccines in early childhood, which are affecting brain development. Because again, autism spectrum disorder is considered a neurodevelopmental disorder. So what that means is something's happening in development. All that makes sense. Those are all very face valid things. What's the data actually say? Is Big Pharma keeping the data from us? Maybe? I don't know. I haven't seen any evidence of that. But like, what are the number of variables that have to quote unquote go wrong in order for you to develop this neurodevelopmental disorder where you become neurotypical or neuroatypical, right? You have deficits of theory of mind, highly fixated repetitive interest, sensitivities to sound in a way that don't make sense for the average person. They're outside the norm, second and third standard deviation, etc. I don't know, right? But there are dozens and dozens of things that can go wrong in early development, right? So like in the first 3 trimesters before you're born, all sorts of bad things can happen, both genetically, due to, the mother drinking, smoking, using other drugs, potentially due to psych meds, potentially due to excessive stress. All of those, what we call teratogens, can affect your brain development in the womb. But we don't have good research on that and the supposed causes of autism. So, right, there's a dozen teratogens. That's 12 things. There are traumas and hypoxia that can happen in the womb. So that's 14 things. There are genetic differences, so that's about 17 things. There are all the different types of things you can be exposed to in early development, right? So the first 8 years of life is crucial for brain development. So like, what else could be going wrong there? It could be other traumas. That's 20 things. It could be neglect, 21 things. It could be crappy diet and formula that's bad for you or whatever, which I don't know anything about, so don't sue me. So that's 23 things. It could be all of the vaccines that you get. So that's 40-something things, right, in total, right, just adding them all up. So you're at like 50 or 60 variables by the time you reach the age of like 2 that could have affected you, that could have maybe, at minimum, 50 or 60 variables that could have affected you, that could have affected your brain development and your social development, that might have made you autistic. So 60 things. And RFK Jr. is going to assign some task force to do the very complicated epidemiological research, observational research, cross-sectional research, to really figure out these 50 or 60 things. You think so? Because I don't think so. I'm all for the Maha people making us healthier. I really hope they succeed. I want them to do nothing but succeed. And the reason's because I think we're a really unhealthy country. Too many of us are fat. Too many of us sit around all day like this. We don't work out enough. We don't eat well. We're an unhealthy country. We have terrible health statistics in the United States, despite being rich. Our country is very sick, mentally and physically. So I wish them well, and I hope that they figure it out. But I think this is just a dog and pony show. I would be shocked if RFK Jr.'s team puts out like 50 peer-reviewed papers in the next 4 years discussing all those 50 or 60 variables I just outlined. I just don't believe it. And I will eat something insane online, live, if he actually does that in the next 4 years. Mark my words. Because what? To actually take all these things seriously, be they more unrelated or more related, would cost billions and billions of dollars. And he doesn't have that budget, number one. But number two, he doesn't have the political will to make it happen. And number three, nobody cares. Number four, everyone's in their camps. The anti-vaxxers, which are different than the vaccine hesitant, which are different than the pro-vaccine, I'm part of the establishment people. All three of those camps have their position staked out, and that's where they're going to live. The seed oils are bad people. They have their position staked out, and that's where they're going to live. So it's just bullshit, I think, personally. So go for it, RFK. I support you. If you want my help, I'm here. I doubt it. I doubt it's going to work. I doubt it's going to help. What would I know? All right. Back to the bookmarks. Okie dokie. Dr. James Davies, PhD, who I've tweeted about before and talked about on this podcast. He posted something 6 days ago. I just posted about it so people can see and come at me. So you know what I'm talking about. There's a track record. There's receipts. Dr. James Davies, PhD. His handle is @JDavies, Davies, PhD. He says, it's less a mental health crisis that's afflicting young adults than a crisis of demoralization. Low wages, high debts / rents means that most can't save for the future, which is the primary compensation for doing unfulfilling work. Seeing no way out is demoralizing a generation. So, I really appreciate Dr. Davies for saying this because it's relatable personally and professionally. So, let's walk this out. Statement 1, argument 1, it's less a mental health crisis that young people are having and more of a demoralization crisis. Now, people like Jonathan Haidt, Gene Twenge, and all these people would argue it's the cell phones that are making us sick and stupid. It's the social media. I don't think that's true. I think that's stupid. I think it's oversimplifying and picking one variable, right? That's called the univariate fallacy. It doesn't have the predictive power that they think it does. Now, what I've said consistently on this podcast and in other podcasts where people interview me is that we should not over-pathologize people. We should try to find either the correct singular diagnosis, if it's possible, in the mental illness world, or we should try to find, in many cases, no diagnosis. I'm very anti-diagnosis as a professional and as a person because I think that these overly simplistic categories of descriptive behavior patterns, while useful for insurance purposes and to some degree for professional communication, are not very useful for really understanding the person and why they're suffering. Because suffering is an attachment to how things should be in the Buddhist sense. So I'm anti-suffering. People are going to be in pain. People are going to be anxious and depressed and sad and not sleep. And all these things are normal and ordinary because that's life. Bad things happen. We have quote-unquote negative reactions. Attaching to how you should be is stupid. How things should be is stupid because there is no should. Right? In the Buddhist sense, there is no should. And that's where I'm going to have to disagree with Dr. Davies, even though I originally agree with him. So here's the ways in which I agree with him. Adolescents and young adults are being overly pathologized by psychiatrists and psychologists and therapists of all kinds. They're being overdiagnosed with autism. They're being overdiagnosed with gender dysphoria. They're being overdiagnosed with substance use disorders. They're being overdiagnosed with PTSD and personality disorders and everything under the sun. Also, there are some segments of the population that are underdiagnosed, believe it or not. But I think in general, the trend is towards overdiagnosis. Secondarily, I agree that pathologizing the normal suffering that people go through is silly and stupid and bad for the world. I think many people have lifestyle problems that are not diagnostic. I think many people are too sedentary. I think many people are too socially disengaged. I think many people are trying to fit into a niche that they don't fit into. For instance, if you're temperamentally very, let's say, extroverted, and you're trying to live a more solitary life, what's wrong with you? For instance. So I think there's all these diseases of living or lifestyle problems that are part of the problem here. So I agree with you, James, Dr. Davies. But let's talk about the second sentence, which is, low wages, high debts / rents means that most can't save for the future, which is the primary compensation for doing unfulfilling work. Seeing no way out, third sentence, is demoralizing a generation. So, I've not been very private about this. I've been very public about this. I have a house's worth of student loan debt to try and become a doctor and help people. And I did it. I succeeded. I am a doctor. Amazing. And that's great. And it sucks that I have a house hanging over my head at all times. Now, I'm trying to pay it off as much as I can. I make decent money, but I live in a ridiculously, stupidly expensive city in Los Angeles. And some of that's by my choice, but some of that's also not by my choice because of where my jobs are and things like that. So, we have a really messed up world economically and socially. That's true. I think that the wild amount of greed in these giant investment companies like BlackRock and Vanguard are part of the problem. 100%. I believe, personally, this is me, Patrick, saying, society is really sick in terms of our attitudes towards socializing and what we consider meaningful. I would agree that there's at least a subtle meaning crisis that's been going on for the last 30 or 40 years because of all the things that all the culture warriors talk about. I think that's all true. But I don't want to get stuck in the univariate fallacy, because I think life is complicated and people's individual situations are different. You know? So, for instance, not having meaningful work is definitely a you problem. In the year of our Lord 2025, if you haven't found a way to do something meaningful, that means that your parents failed you, your teachers failed you, your friends failed you. Because there are hundreds, if not thousands, of ways to do meaningful things for work. I'm not saying that, if you're doing a job you don't find meaningful, that you should magically be able to reframe what you're experiencing at work and make it meaningful. Because reframing is a therapy skill that you do in cognitive therapy to help people have a new perspective on a problematic thought. So just to name an example, if you're a plumber and you don't really find your work very meaningful, that's fine. Sometimes people are perfectly satisfied not finding meaning in their work because it's just a job, but they find meaning in their family, in their friends, in their hobbies, in social media, and all these other things. You might find meaning in dozens of things other than your job. Some people have, quote unquote, just a job, whereas other people have an actual career. Now, some people are the kind of people who genuinely find their job extremely meaningful, and you might think it's in the category of job, like being a plumber, for instance, or a mechanic, right? These very concrete and routine things that don't seem super fascinating to some people might be super fascinating to a particular kind of person. For instance, let's talk about autistic people. Autistic people tend to love things over people, for instance, and are more fascinated by things over people in many cases. And so maybe it's the case that if you are on the spectrum and you have a job where your task is to take cool shit apart and put it back together again, like a mechanic or a plumber or an engineer or a rocket scientist, you might be so thrilled with your career, your job. Other people might think your job is not super interesting, but you might think it's super interesting. So people are different. And so, Dr. Davies, I partially agree with you, but also disagree, because who knows how many people find their work meaningful. There really isn't reliable data that I'm aware of that says people are losing their minds and burnt out because their job is not very meaningful. I'm sure it's true for some people, but let's use myself as an example again. Let's talk about poor adolescents who have to work these so-called menial jobs at fast food restaurants and car washes and all this kind of entry-level job stuff that teenagers typically do. So here's the truth. Once upon a time, Dr. Lockwood, I used to work at McDonald's, and I loved it and hated it. So when I was a teenager, from 15 and a half or whatever to 18, before I went away to college, I spent 3 years at McDonald's. So what I hated was everything I did for work. Cleaning the driveway at 4 in the morning, power washing it, or cleaning the fridges, or on the rare occasions where I actually made the food, making the food. Right? I think it was kind of an interesting challenge to learn how to wrap the sandwiches, because I don't have great dexterity compared to other people. So the dexterity challenged person that I am was oh, this is kind of an interesting challenge, but I hated it because it was pressure. Did I like getting the food off of the truck and stacking it and figuring out how to stack the food in the freezer? That was kind of a fun challenge. It was kind of the dude in me is kind of oh, how do I make them all fit? How do I get the nuggets stacked over there and the burger stacked over there? And how do I get it organized? Because my buddy Sean and I were trying to get it organized well so we can walk in and get the food and and make the business efficient. So I like efficiency. I like the Tetris of figuring out how to stack the boxes in the freezer and stuff. I liked getting a workout or whatever. But like, I hated the job in general. Now, what I liked were the people, because for the most part, the people accepted me and we had fun, and some of them were friends from my high school. So like, I don't know, the spectrum-y piece of me is like stack the boxes just the right way and like get it perfect and make it like super accessible and logical. That made sense to me. But then what really made me enjoy the job, despite the fact that it was like very terrible wages and like not a super fun work environment other than like the few friends from high school, my buddy Sean. Shout out to my buddy Sean O'Gorman. I hope you're still alive and you're doing well back in Missouri. What I enjoyed was like camaraderie with a couple of people who were going through the same thing as me. So like I was able to find certain things about it enjoyable, despite the fact that, you know, you're working at McDonald's and you're a kid and you're like trying to go on to the next thing. That all sucked. Getting up at 4 a.m. sucked. Like a lot of things sucked about the job. So like, can you find your way out of the suck in your job? Probably. I would hope so. If you're not stupid, I think you can find your way out of the suck. Now, that doesn't mean your job has to be super deep and profound. I think that's bullshit. You've heard me criticize like the Jordan Petersons of the world and all these other culture warriors and public intellectuals who are like, oh, we have a meaning crisis, and until people find more meaning, society is screwed and we're all going to die and whatever. And the trans people are going to take over the country or whatever stupid bullshit. What I will say is, not everything has to be super meaningful for us to be okay as a species and survive. So maybe your job is not super meaningful, but maybe it gives you money to go do the other meaningful things that matter to you in your life. That seems perfectly ordinary. Or sometimes your job is a real career and it's super meaningful. Or sometimes, like my McDonald's job as a kid, it's a mixture of like not very meaningful and stupid and I hate it, and it's kind of meaningful. I don't know. I think people are complicated. I think it's kind of different for every person. So why do we talk at these like levels of abstraction? Why do we talk at the macro level as if we know how all people are doing when we have no clue? I'm kind of sick and tired of the public intellectuals of the world, but that's how you get attention. It's how you get clicks and whatever. It's like nobody really knows how much meaning people are experiencing in different things, because like every city is different. I technically live in Los Angeles, which is a terrible fucking city, but there are little pockets of LA which are cool, with cool people I like. That's normal. And I imagine that's true all over the world, but especially in the United States, because the USA is this really weird, interesting melting pot, which I'm very grateful for. So like, when people yammer on and masturbate loudly online about the meaning crisis, and again, Dr. Davies, I agree with you. That's where we started. I think that some people are feeling demoralized because they don't see a way out of like serious debt. Like, I do agree that college is just a debt slave system. I am very anti this debt slavery thing that we're doing. I think it's stupid. I think there are better models. I think Bernie Sanders' model, Patrick Lockwood, not Dr. Lockwood, Patrick Lockwood believes in Bernie Sanders' plan to pay off student loan debt. I think it's so stupid when every other civilized society can find a way around it. We do this. It's so bullshit. So let's figure that out, and let's not use debt slavery as a way to like keep people in line. That's so demoralizing. So I do agree with you, Dr. Davies. And I do agree that rents are too expensive, and these greedy fucking assholes at Vanguard and BlackRock and whatever are hurting people. So fuck all of them. And what I would say is, but if you want to sponsor my podcast, I'm here for it. But what I do believe is true is you can find meaning in so many things in your life. It's really infantilizing to pretend that people are so stupid and so stressed out by debt that they can't find meaning with their friends, or like go have a beer and watch the game or whatever, right? Like, I believe in the resilience of people, back to my earlier discussion with systemic Texisms tweets. Like, I don't think anybody is fragile. I think it's so statistically rare that people are actually fragile. So like to give some obvious examples of what are genuinely fragile people, like people who are actively being assaulted are very vulnerable. People in active war zones are very vulnerable. People who have serious disabilities, right? Like IQ south of 75, 80, or, serious stroke issues, serious Alzheimer's, dementia, like people with serious illnesses are very vulnerable and on the more fragile side. But like the average person might be sensitive, but not fragile. So like if you're temperamentally very neurotic, you score at like the 80th percentile or higher of trait neuroticism, yeah, your life is going to be difficult, but like you're not fragile. You're just kind of sensitive in a way that you have to compensate for. So almost no one is really fragile. Maybe 1% or 5% of the population is on the fragile side of the spectrum. I would imagine it's extremely rare. So can we not infantilize people, Dr. Davis? I can agree to an extent, but people are not fragile. And we should stop treating people as if they are. And we should encourage people to find meaning in their life because it's not impossible. I think the system sucks and you can figure your way out of it. Entrepreneurs do it all the time. You are not helpless. You are not stupid and you are not incapable. You might have limitations because that's ordinary and normal, but you are not incapable. So what are we talking about here, Dr. Davies? What is this? Someone help me understand. All right. Moving right along. Let's talk about suicide because that's fun. Alrighty. So, there were a couple of big posts out this week. One from the famous psychiatrist Alan Francis, who's on Twitter. I've talked about a few times. A number of people. And there's this new paper that came out that talked about the so-called zero suicide model that was more effective in preventing completed suicide than other models. Great. Love that. Let me just tell you this. There are rigid protocols which basically do nothing. And suicide's a very scandalous thing, so I get it. I'm not hip. I'm hip. I get it. Here's what I believe. When we talk about suicide, as professionals but also as regular people, people automatically are in fear, which is totally fine because suicide is scary. Nobody wants their loved one to die by suicide. It's very sad. People have all sorts of moral opinions about suicide, so it's even more fear-inducing. That's all fine. Here's the problem. The problem we face is when we ramble endlessly about, models, or we put our belief in like anti-suicide or suicide prevention campaigns or whatever it is, I think it's more about satisfying the fear of people than it is actually about effectively helping assess and support people who are struggling with suicidal ideation. The vast majority of people with suicidal ideation, by the way, don't go on to attempt or hurt themselves. So suicide's rare. I don't know if you know this, but suicide's actually very rare. Or at least the typical definition of suicide, which is like you doing something acutely right now that will end your life, like serious harm by guns or overdosing on pills or whatever it is. There are different types of suicide, if you want to consider like, suicide by cop or, the things that people pejoratively call suicide, like drinking too much or eating terribly. That's a form of suicide. I don't agree with those narratives, but I get it. So like when we're talking about what people typically call suicide, it's very rare. And so should we worry as much as we do? Probably not, would be my guess. I don't think all these fear porn campaigns about like zero suicide or whatever are going to help because there's no such thing as zero suicide. There's no way. I cannot think of a way in which you could perfectly like micromanage society and engineer society or like Gattaca, like bioengineer people to like actually prevent suicide. I don't think it's possible. I think Humans are going to suffer. Humans are going to be attached to how things should be, erroneously, in my opinion. I think attachment is the root of all suffering, like the Buddhists say. So why attach? That's silly. It's stupid. But it's also normal. It is the ordinary state of human affairs to be ambivalent and to attach. That's how we're wired. And so these zero suicide campaigns don't make any sense to me. I think that's stupid. I think it's propaganda to make political people and mental health providers and administrators at the American Medical Association or whatever, make them all feel good about themselves. And that's stupid. I get it because that's how society works, but it's stupid. There's no such thing as zero suicide. I don't want anybody to die by suicide. I am all about trying to help people who are struggling with the serious mental health problems that relate to suicide and the problems of living that relate to suicide and drugs and all these things. So I am not pro-suicide, just so we're clear. I understand why some people take their lives, so I can be empathetic and understanding about it, but that doesn't mean I condone it or think it's the best choice. I can only think of the most rare instances where it makes the most sense. That being said, zero suicide is silly, right? You can care about people and not make ridiculous propaganda campaigns. Even Alan Francis agreed with me on Twitter. He's like, yeah, the title is stupid, but some of the practices are good. Great. So let's get rid of the stupid fucking title, shall we? I don't know. What would I know? I'm just some fucking guy in a coat rambling on YouTube. What would I know? All right. I'm going to skip a post and go on to one of my favorite ones. I'm going to tweet about it real quick because I think this is good shit. Just 1 second. So sorry. All right. So Sarah / psychotherapist is her name. And her full handle is at the how of calm. At THEHOWOFCALM. So Sarah, the psychotherapist, says, if your therapist only validates you and never calls you out for your unhelpful patterns, you don't have a therapist. You might just have a paid enabler. And I don't know what to tell you other than fuck yeah, Sarah. So she said again, if you have a therapist who only validates you and never calls you out for your unhelpful patterns, you don't have a therapist. You might just have a paid for enabler. Here's the deal, folks. Therapy is important. It helps some people with serious mental health issues, and it can help people even without them. I think when you don't have a real diagnosis of something and you're in therapy, you're just kind of having a paid for best friend or a paid for mentor or parent or something. So kind of weird, kind of unethical, fairly unethical, but maybe there's some exceptions. If you have the money and it's cash or whatever. And if that's how your consent forms are written, whatever. Here's the deal. I'm a doctor, and so I believe I'm here to treat serious illnesses. I'm here to treat illnesses as a doctor. Now, this is me talking as Patrick, though. If you're a doctor and you're here to treat illnesses, you're here to look at the whole picture, the whole person, the biological, the psychological, and social, the behavior patterns that are new and old. And what do those behavior patterns mean? If you're a therapist of any kind, a psychiatrist, a psychologist, an LMFT, LPCC, LCSW, whatever, fucking life coach, if you think your patients are all good, you're a moron. If you think your patients are lovely, brilliant people, and you have only positive things to think about them because you heard Carl Rogers say, unconditional positive regard, then I think you're even missing the point of what Carl Rogers meant. Carl, my buddy Carl Rogers, the humanistic existential guy, knew that people were flawed, knew that people had problems, knew that people were engaging in unhelpful patterns. And part of what would help them was not to believe that they're perfect saints or something, or that their behavior was beyond reproach and it's everybody else that's the problem. Carl knew that because people are so full of shame, and in many cases self-hatred, or serious problematic, cognitive distortions, unhelpful beliefs about themselves, core negative beliefs, whatever you want to call it, Carl was aware that we can treat ourselves like shit. We can think terrible things about ourselves that are not grounded in the data. And so Carl was trying to help people provide a countervailing force to all those very understandable ways of talking to oneself and thinking about oneself that are self-defeating. Carl Rogers was not Pollyanna. He did not believe that everyone's amazing and sunshines and butterflies. Carl Rogers was trained as a psychoanalyst. He knew that we can interject and have bad experiences and have pathological beliefs about ourselves. He's trying to counter that. Now, is it the most effective intervention? I don't know, whatever. But he wasn't trying to be Pollyanna about it. And so if you have a therapist, if you have a paid for mental health professional of any degree level saying you're not the problem, then you are being lied to. And that person is, frankly, I think, being negligent. Because the truth of the matter is, all of us do screwed up stuff, myself included, obviously. We all make mistakes. We all have blind spots, and we all don't see how we contribute to problematic patterns of behavior. Also, you can't change other people. You cannot magically change someone else's behavior. It's impossible. You can do little things to influence people, but influencing people is not changing them. And so when a therapist of any kind, a psychiatrist, psychologist, whatever, tells you you're not the problem, it's them. I mean, sometimes people are really sick and mean and vicious, and so they're bad. Whatever. That happens. There are exceptions, for sure, so I'm not trying to be black and white about it. But if you don't take accountability for how you show up in relationships, then you're going to pretend erroneously that you're only ever a victim to the outside world, which is stupid, not based in reality, not how good therapy works, not what the data say, etc. Literally, you are responsible for how you show up in relationships. And so if you don't try to take accountability for how you show up, not taking excessive accountability, but if you don't take some accountability, maybe you should be more assertive. Or maybe you should shut your mouth more because maybe you talk too much, or whatever it is. There's so many things we can do differently that will influence other people and influence the dynamic we find ourselves in. These problematic dynamics in families and friends and romantic relationships at work are not stagnant. You can change dynamics by how you show up. You can quit your terrible job and find something more meaningful. It'll suck, but you can do it. You can leave that terrible relationship or try to assert yourself better in your difficult romantic relationship. You can go to couples therapy. You can do all sorts of stuff. So please, do not have a paid best friend. If you have a paid best friend, please leave them. Because they're not helping you. They're enabling you. They're trying to convince you that you are somehow so smart, so special, so brilliant, so moral, so pure that you're doing nothing wrong in your problematic dynamics. And that is not life. Real life for all regular people, which includes myself and everyone else watching and listening, is we are not perfect. We should take accountability for our behavior so that we can influence people better, because that's all we can control. We literally cannot control other people except for pointing a gun at them and forcing them to put handcuffs on. Then you're controlling people. Until you're physically putting your hands on somebody or threatening them with serious force, you don't control people. All you can do is influence people. That's rational. That's the Buddhist perspective. So if you want to influence people better, take better care of yourself. Focus on what you can do differently. And you'll succeed more in life. You'll do better at work. You'll do better in your romantic relationships. You'll do better in your friendships and your family life. It's really not complicated. Take more accountability. Fix your patterns of behavior. Because that's all you can really influence. And you can't even really influence some of that because a lot of it's personality and IQ stuff, which is kind of out of your control to some significant degree. Some of it's culture. Some of it's in your control. And whatever's in your control, work on that. So what I will tell you is, fuck yeah, Sarah. Thank you for posting that. Because what the hell? I hate those kinds of professionals. They are hurting people. They are hurting the profession. They're setting us all back. There's a very common sense, personal responsibility, whatever, conservative, whatever, way of functioning, which is, maybe I play a role. Maybe I should do something differently. Jordan Peterson was on about this for years ago. Other philosophers have been, therapists have been, Stephen Hayes from ACT, all these people. This is not a new message. It just needs to be said over and over and over again. You are not stupid. You are not fragile. You are capable. You are capable. You are capable. You might be miserable, and that happens, and sometimes some of it's your fault, and sometimes it's the world's fault, but there's something you can do. Almost always, unless you're seriously mentally ill or seriously physically ill, there's almost always something you can do. It might suck what you have to do to get better, but you can do it because you're capable. And I want that to be the spirit of UnShrink Me. I'm anti-bad shrinks and I'm pro-good shrinks. You are capable. The people that send you the message that you are capable, stick close to them because they care about you and they see what you're really made out of. Okay? All right, I think that's enough for today. So, as always, on UnShrink Me, this is Patrick Lockwood, not Dr. Patrick Lockwood, sharing his thoughts and rambling, having fun. I'm here having fun. Thanks for joining up, commenting, like, share. Please like, share, and subscribe, and let other people know because I'm here to have fun and create more informed consumers so that people get more out of their mental health professionals and more out of the YouTubers and podcasters that they like who talk about mental health. As always, I end my shows with a dad joke. So here we go. Once upon a time, I treated a priest. Interesting guy. Been a priest for 60 years. It's a long life. Older guy. He came to me because he just quit being a priest. And he's very stressed about what to do with his life. So we talked about the stress and stress management and some psychoeducation and stuff. But, I've watched a lot of horror movies in my life, like a lot of demon possession movies and stuff like that. I just rewatched Constantine, which I love. And so this priest was just telling me all about his life and all about the people he worked with. And he got to meet the Pope once, which was super cool. And, about halfway through the session, kind of my curiosity got the best of me. And I asked him, sir, how do you, I've seen all these, I told him, I watch horror movies a lot, and so I'm always curious, how does holy water work? How do people make it? Because, I see it in all these demon movies and stuff and possession movies. And he says, it's not really complicated. All you have to do to make holy water is just burn the hell out of it.